So here we have a 45-year-old male who has severe pain down his leg. And we all know this as sciatica. Well, what actually causes sciatica? I want to do a deep dive in here to this patient's MRI and really show you what's causing his pain. What we have on this side is called the sagittal image, where we're looking from the side. And you can see the spinal cord coming down the middle. You could see the vertebral bodies up front, and you could see the posterior elements. These are the spinous process. Well, as we scroll through this, we start looking at all the discs. And what we see here is a disc bulge coming out at L5-S1. You can see that black area right there. I'll highlight it for you. This pushing out into the spinal canal can really cause issues. The spinal cord ends around L1, L2, so it doesn't cause issues with the spinal cord, but the spinal nerves that exit at each level can be compressed here. We really don't know where it's compressing exactly till we look on this side, where we can see the axial view. The axial view is cutting you like pancakes and basically stacking that on top of itself. As I scroll up and down, we can see all the way up from L1 here as I scroll down, L2 very nice and open, L3 very nice and open, all the way down to the issue at L5. I want to start with a normal level though at L4-5. We see on the left side here on the sagittal, there's no disc herniation. The disc is very nice in this area. The vertebral bodies are surrounding it and there's no issues there. As we look at the axial, we see that there is this disc right here on the anterior component. These are the psoas muscles up front. These are the paraspinal lumbar muscles in the back. Now we get to what really matters, the nerves of the lower back. And this is L4-5 once again. These little nerve roots are the roots coming down, and they exit at each level. They exit through the foramen at each level to the left and right side. This one has no issues. This is a beautiful L4-5, beautiful exiting nerve roots, beautiful disc. No issues. But when we scroll down here, you'll notice there's a big difference. And where is that big difference? Well, it's right here with this disc herniation. And I hope you can appreciate that versus the last one. And we can even go side to side here. So as we know, with all MRIs, they're inverted, right? So this is actually the right side and this is the left side. So this patient has that severe left-sided pain. As we look on this right side, the foramen here is wide open. This is the nerve root that's going to be traversing out this foramen. There's plenty of room for it. The disc on this side is not herniated. But as we look on this side where the disc herniation is right there. And where is the nerve root? It is squished right here. It's supposed to be up here like this one is on the right side. But it's being pushed back, causing not only a compression, but also an irritation of that nerve root. And that nerve root has to now slip through here. And that nerve is moving. So when you're moving and grooving, when you're walking, that nerve is sliding through that foramen and kind of going over a pinch point there and just getting more and more and more irritated. That's going to cause severe pain down the leg. So this is what an MRI looks like when we say there's a disc herniation with compression on the nerve. This is a very acute herniation. We can tell by how pronounced it is. Your body's had no time to remodel this disc herniation. How do patients do from these disc herniations? Well, we want to start with some anti-inflammatories, muscle relaxants, see if we just calm this down, put some water on the fire. The next thing we're going to do pretty quickly is probably do an epidural, try to get some steroids right in that area. Unfortunately, about 50% of these patients, though, still need what's called a discectomy or a microdiscectomy where the surgeon will go in and actually pick out this area. The good news is most of these patients do very, very well, whether it's spontaneous resorption of that disc or if it's a surgery for this disc. The full amount of pain should be resolved. There shouldn't be any long-lasting weakness. Where patients can get in trouble with this is if they let this go for a long time. You start damaging that nerve starts to die. You start getting weakness, some muscle weakness, or like a foot drop. I think you've all heard of that. That's when we have some long-term issues. But as long as we can get on this quickly, put some water on that fire, as we like to call it, with an epidural, or go in and actually decompress the whole area, this patient should do very, very well. But this is a great example of a patient with severe leg pain, sciatica, caused by a disc herniation pushing right on that nerve.